The world has now grown to over 5 billion people, and each day that number grows. We often see the world in so many vast and contradictory terms, but really, what is your world if defined by nothing more than the health and well-being of the community in which you live? So if it's within your power, what kind of world would you build? What kind of decisions would you make for yourself and for your neighbors as you follow a map to a healthier community? In collaboration with the Centers for Disease Control and Prevention, the National Association of County and City Health Officials, NACCHO, has developed a powerful new tool called MAPP. This community-wide strategic planning tool helps communities achieve improved health and quality of life by mobilizing partnerships and taking strategic actions.
A community makes a decision to use something like MAPP because they see an opportunity for getting a breakthrough. I think many of us have been frustrated by the persistent disparities in health status in our communities and some persistent levels of diseases that could be prevented. And MAPP does provide an opportunity to take a fresh look and actually then potentially have a breakthrough.
Carefully designed to provide useful and practical guidance, MAPP allows for enough flexibility to be adaptable to any community and useful in response to many different situations.
MAPP is different from other processes or tools in that MAPP is a strategic process. It builds on business models of strategic planning processes that incorporate visioning and understanding forces of change as well as the identification of strategic issues.
MAPP includes the community in the planning process by recruiting as many members of the community as is possible. That would include volunteer organizations, organized organizations, residents, any group that had a significant part to play in the improvement of the health of the community.
It can be used for a special interest group. It can be used to address bioterrorism. It's really the process that's critical, and I think that's the most outstanding component of MAPP.
The MAPP process allows for communities to focus their resources and their community interest to come together in a way where all community members and organizations can work collaboratively together for the purpose of improving the community's health.
It also lets the community look at the local public health system. Does the public health system meet the needs of the community? Does it have the services that are needed or not needed? It also allows the community to look at forces of change. What are those things going on in the community that will make it a healthier community or not make it a healthier community? Then they can make decisions about what they can do as a community to improve the health of that community.
In beginning the MAPP process, there must be substantive internal reflection on the question why one should or want to initiate MAPP, because MAPP is a process not to be taken lightly. Answering the question why will help propel MAPP. Secondly comes the process of community engagement, and this really requires an attitudinal and philosophical change to understanding and listening to and having dialogue with community partners in fostering community relationships. Thirdly, an important step in initiating the MAPP process has to do with understanding how ready a community is to engage. A part of one of the early phases of MAPP provides readiness assessment tools which help communities understand whether or not they have the requisite human and financial resources in place to support and sustain the MAPP process over time.
Many people in a community assume that the MAPP process is the sole responsibility of the local public health department. That's not the case.
Sometimes we believe that public health is our responsibility and that we singly are going to be responsible. But I think the reality of today is that there's just not enough money printed, and there's not enough people that we can engender within the governmental public health organization to do all that we need to do. And if we're going to be successful, and I believe that the citizens in our country are looking to us to be successful, then we need to reach out to all of those constituents, whether it's in hospitals or physician offices or schools or churches or any number of organizations that contribute to the overall interest of public health. We need to engage them.
MAPP is designed to reach out and mobilize community resources. It establishes a different approach to problem solving while instilling enthusiasm and a collaborative spirit of moving forward. MAPP puts the public back into public health.
MAPP provides me with an opportunity to work with a group of people I would not ordinarily have contact with, medical professionals, county and public health officials, and community members that I have not had an opportunity to work with before.
As a community representative, I don't like to come to the table after you have made the decision. I want to be at the table when you are making the decision. So that's the first thing that I would say. Be sure you have as many people represented around the table who are the stakeholders.
Well, the MAPP process allows me to work with the community at large. The Steering Council is made up of a very diverse group in terms of ethnicity and also in terms of where different people come from, their workplaces, and where they live in DeKalb County.
It provides for or allows a community collaborative approach to understanding health and health care. And through that, it allows for the identification of shared assets as well as duplication and unmet needs. A long-term benefit is that because it is meant to be a community-driven approach, it has the best opportunity for long-term sustainability.
MAPP, I believe, will benefit a community by the very core recognition that is part of the MAPP process that public health is a community affair, that it is not simply the job of the government public health agency, but in fact is improving the health of the public is the job of variety of sectors in that community, and that all of those sectors have a stake in health improvement.
Our belief is that MAPP packages tools that are tried and true and processes which have been tried by a number of people and allows the community, working with their health department, to find a way, a path that will lead to the most successful outcome. If you take the steps, if you use the steps and the guidance that is in MAPP, I believe you have the opportunity to be most effective in your quality improvement efforts and in making public health more effective for the community in which you live.
Well, one of the ways we're using MAPP in Mendocino County is that we are actually doing a county-wide process as well as doing parallel processes, MAPP processes in 3 different towns. So we're getting kind of a macro level for the county as well as sub-county level or zip code level data, which we can use to compare to the whole county or to individual communities.
In San Antonio, we're using MAPP to try to build on the good work that's already been done. We have a number of agencies that have been working in the community, and they have developed a list of issues that are important. And we want to take that information and build upon that